Hospice care is a critical service that provides comfort and support to individuals with an anticipated life expectancy of 6 months or less, where the focus shifts from curing the illness to enhancing the quality of life. This type of care is comprehensive, addressing physical, psychosocial, and spiritual needs. It involves an interdisciplinary team of professionals, including doctors, nurses, social workers, and spiritual advisors, who work together to ensure the patient and their family receive the best possible care. Hospice care is person-centered, meaning it focuses on the unique needs and preferences of the patient. This care is usually provided where the patient lives, whether in a private residence, nursing home, or community living arrangement. The goal is to allow the patient to be surrounded by their personal belongings and family, providing a sense of familiarity and comfort. Hospice care includes periodic visits from team members to manage symptoms and support the family. Hospice providers are available by phone 24/7 to respond to any concerns that arise. It's important to understand what hospice care is not. Hospice care is not designed to prolong life through curative therapies or medical interventions. It is not a replacement for nursing home care or other residential care and typically does not involve 24/7 bedside care in most cases. Hospice care does not hasten death. Rather, it focuses on providing comfort and dignity during the final stages of life. When should hospice care be considered? Hospice care can be beneficial well before the final days of life. It should be considered when there is a significant decline in physical or cognitive status, despite medical treatment, when the goal is to live more comfortably rather than pursuing aggressive treatments, or when the life expectancy is 6 months or less according to physicians. Hospice care is also appropriate for individuals in the end stages of Alzheimer's or dementia. Adults with a terminal illness and a prognosis of 6 months or less are eligible for hospice care. Hospice services are available for children and adolescents, though the rules and regulations differ from those for adults. Common diagnoses for hospice care include cancer, heart disease, dementia, Parkinson's disease, lung disease, stroke, chronic kidney disease, cirrhosis, and ALS. Initiating hospice care can often be a challenge due to lack of awareness or reluctance to discuss it. Many individuals and families could benefit from hospice care, but are unsure how to access it. Physicians can suggest hospice care, but families and patients can also initiate discussions with their healthcare providers about eligibility and services. To qualify for hospice services, a hospice physician and a second physician must certify that the patient meets specific medical eligibility criteria. This typically involves a prognosis of 6 months or less if the illness runs its typical course. Referrals to hospice care often begin with the attending or specialist physician who knows the patient's medical history. Self and family referrals are also possible, but eligibility must be confirmed by physicians. Hospice care includes a range of services designed to manage the primary illness and provide support. This includes time and services from the care team, medication for symptom control, medical equipment, and any other necessary services covered by Medicare. Short-term inpatient care and respite care for family caregivers are also provided. Additionally, grief and loss counseling is available to family members for up to 13 months after the death of a loved one. Understanding hospice care and knowing when to seek it can significantly improve the quality of life for patients and provide much-needed support for their families.